Shari Criso, and this is the My Baby Expert Show, and I am so happy to be here with you tonight, and I have my very special guest and my very, very favorite friend, Jennifer Marotta, here with me.
Hi, everybody.
There you are. Say hi, Jen.
Excited to
Everybody
be here.
Knows Jen, right? So Jen is my mommy expert that comes on and gives us all the tips, okay? Everything that we need to know, especially when it comes to raising small children and lots of them all at the same time, right?
Lots of little ones.
Lots of little ones. But tonight is a really important topic, and it's something that, I know that we've been wanting to cover for a while because we don't pay too much attention or really focus that much on our own personal needs and how much that actually affects our mothering, how much that affects our children, and how much it affects the enjoyment overall of that first year or longer of really being a parent, you know? And when you're feeling exhausted and you're not sleeping, and we all know that feeling because we all go through it as new parents, it can make it seem like time is taking forever and that life is just not enjoyable and you're just waiting to get it over with, which is not exactly what you want to do as a new parent. So tonight's a really great show, and I'm glad that we're getting a chance to do it. And I thought, who better to bring on than Jen, who, like she said, had how close are the kids?
Just under 18 months apart.
Just under 18 months apart. Three of them. Yeah. So, I don't know. Let's talk a little bit about sleep deprivation and what that means for you, and what the risks are when a parent is deprived of sleep. They say that first a parent can lose up to 350 hours of sleep in that first year of their baby's life.
Up to? I would think it would be minimum of.
Maybe minimum of 350 hours of lost sleep in that first year, which, I'm not surprised. I know for me, my children did not sleep well. They were up often during the night. They did not sleep through the night a lot, most of the first year, both of my kids. And I just remember that feeling of just feeling completely sleep deprived all the time. For me, it was sort of something I was used to. I had worked nights as a nurse for 7 years. I had been a midwife and been called out in the middle of the night. I was an expert sleep deprived person.
She still is.
I still am. You're right. I sleep now. I do sleep now. I'm catching up now on all those years of not sleeping
still
enough.
Paying it off.
I'm still paying it off. But I know how difficult it was to concentrate, to do my job, to run my businesses, to take care of my children, to, be with my husband and be happy and have a family. And it was just really difficult when you're feeling like that, right?
Yeah.
It's just really difficult. So, some of the things that you can really see with sleep deprivation is that, you may have trouble waking in the morning. It's you're going to feel so tired. Like you feel like you just fell asleep. You know that feeling? Yeah. Where like you just finally fell asleep and then it's like baby's up crying again. But that trouble waking where you're just feeling so groggy. The irritableness, that comes with feeling tired, feeling that irritableness, that anxiety, the inability to concentrate.
Oh, yeah.
Okay, nodding off, nodding off, at work, nodding off at home. And this can actually be a safety issue. You think about, sitting in the chair with your baby.
My husband did that with not one, but both of our twins on two separate occasions. Once in the hospital, he fell asleep holding one. I was asleep. Mom instinct woke up and said, "Where's the baby?" And he's like, "In the bassinet." I'm like, "No, she's on the floor."
Oh, you're kidding?
No, not at all.
Oh, you dropped the baby.
Oh, yeah. Slid out of his arms, landed on a bag, and she was okay. She wasn't even crying, but thank God I woke up. And he did it once again at home, too, and I just heard this thunk, and I'm like, "You dropped the baby again!" Because he just was so tired. It's true, and it happened because he's tired. And if you're that tired, you shouldn't be holding your baby.
You don't know how common this is, and this is really, really dangerous. Sitting in a glider, falling asleep, the baby can fall out of your arms. Sitting on the couch, baby can fall between the cushions. These are all like hazards that the baby can actually really get hurt or die from something like that. I actually remember, I'll never forget, a couple years ago I had a dad who walked into the store. It was just at closing. He was a big guy, maybe 6 foot, something. And he walked in, he had tears in his eyes. And I remember asking him, "Are you okay?" And he said, "Yeah." He said, "Do you have some kind of a carrier or a sling that would fit me?" And I said, "Sure, I do. Let's fit you for something." I said, "What happened?" He said, "We're on our way home from the emergency room. I fell asleep in the glider with the baby, and I dropped the baby to the floor." The baby was fine, but, you know,
Yeah.
he was just completely
Yeah.
shook up from the whole experience, as you can imagine. And so you really need to stay awake. I
Yeah.
mean, you really, if you feel like you're that, you know, that, if you're that groggy,
Tired.
if you're that tired, you really need
And
to
I have to
pay
say also,
attention.
it sort of was a dad thing. I saw someone posted too that their husband dropped the baby and she rolled down his legs. That's kind of what happened
Yes.
to my girls, thank God.
Yes.
But I've never done that as the mom. Like, I've started to go and then jerked and just been like, no, I have to put the baby down. Whereas my husband, he didn't have that instinct.
Yes. And that's really important, that if you're feeling that tired, that you put the baby down, or that you call someone to help you, you know, to bring a neighbor in, you know, get some help, get a friend to come, you know, hold the baby for a little while you take a nap.
Yeah, exactly.
But you really got to pay attention. I think the most important thing is really paying attention to the signals that your body is giving you. If you feel yourself dozing, it's sort of like driving. You know, you feel yourself dozing while you're driving, you pull over.
It's worse to be tired, right, than having some alcohol in your system.
Oh, yeah.
Fatigue is just as bad as drunk.
Causes more accidents.
Yeah, I believe it.
So you can imagine the same thing with your babies, you know. It'll also cause a decrease in your immunity, too. So, you know, that's
what happens.
Yeah, when you're not getting enough sleep, you know, sleeping is just as important as eating healthy. It's just as important as being hydrated. It can really affect every part of your body. It can decrease your immune system. It can create situations where you're more susceptible to obesity. It can create situations where you're more susceptible to diabetes. You know, it causes
stress, is what it does.
Exactly, on your entire system.
Yep.
On your entire system. And then in the worst case scenarios, it can cause child abuse.
Yeah.
You know, shaken baby syndrome. People get completely overtired, irrational, and, you know, they have a crying baby and they can shake a baby, and that's how babies die.
And, you know, I read that happens more often now than it did 50 years ago, because 50 years ago, it was okay to let your baby cry. Like, there was nobody made you feel guilty for your baby crying. Nobody said, oh, you have to hold them all the time. And I'm not saying that I was one of those moms that didn't hold my baby all the time, but back when my mom had kids and her mom had kids, they were like, if that baby's frustrating, you just put them down and go do something else. And that's the safest thing to do. Put the baby down for a little bit in someplace safe and go somewhere else. Whereas now it's not as okay to do that.
Yeah, absolutely. No, I could totally see that, you know. And sometimes it's actually, the other way is to, like we were talking about the carriers and slings, sometimes your baby's crying because they want to be held, which is hard if you're trying to get some rest. But, you know, even just wearing your baby when you're walking around, you know, wearing your baby when you're sitting on the couch, wearing your baby when you're sitting in the chair, so that if you did doze off, the baby's not falling
And I
out of
think
your
falling
arms.
asleep with your baby is fine if you're set up in the bed, like, we are going to sleep, I am going to lay in this appropriate way with the baby in a safe place. But for me, falling asleep unprepared was a dangerous situation.
It's the difference between like, sleeping with your baby is okay.
Right.
Falling asleep with your baby is not okay.
Yeah.
Okay, so there's a difference there. You know, setting up your baby to
sleeping in your car is okay. Falling asleep at the wheel, not okay.
Something like that, yeah. No, but, you know, like, actually co-sleeping, you know, setting yourself up to co-sleep with your baby can actually help with your sleep.
Yeah.
You know, where you don't have to get up at night. And we're going to get into that in a minute with things that you can do.
Yes.
To help with sleep deprivation. Okay, so how much sleep do you actually need? Because that's really, like, that's the question, you know. Do we need a lot of sleep, and what is it, you know?
Depends on you and depends on your quality of life.
Yeah. Everybody needs a different amount of sleep. It's a very individual thing as to, like, you know, and you know friends who can get away with, like, very little sleep and they're fine. And then other people who, if they're not getting, like, their 9 hours, they're shot, right? So everybody needs a, you know, different amount, but the average, somewhere between 7 and 9 hours, is about the right amount of sleep that most people need.
Yeah.
And it doesn't need to be continuous.
No.
And that's what I think is the most important point to make here, is that it does not need to be continuous sleep. You want to talk a little bit about that?
Yeah, there's this thing called the Basic Rest Activity Cycle, BRAC, and all human beings have it. It runs at about 90 minutes. Children can usually stay awake for one 90-minute cycle, and you know, small infants can sleep for maybe 1 or 2 90-minute cycles, so 3 hours would be your big stretch for a little infant. And adults, their sleep cycle goes in 90-minute increments. So you would feel more rested, theoretically, sleeping for 3 hours than you would sleeping for 4 hours. You ever fall asleep and only get 3 hours of sleep and wake up and you're like, why do I feel okay? And then another night you'll get 5 hours of sleep and you feel like death.
Yeah.
That has a lot to do with it. Everybody's a little different, but that BRAC really helps, and that can help you determine when your baby's tired too.
Yes. Yeah.
So, and you can notice this in yourself. Tomorrow when you wake up, look at the clock, and if it's 8 o'clock, at 9:30, when you start to feel a little tired, you'll be like, oh, that's my activity cycle. That's my body's way of saying, oh, I'm a little tired. My activity cycle just ended.
Yeah.
And looking at that in you and in your baby is going to help you guys determine when you're primed for a nap. And it's the same thing if you wake up in the middle of the night from the baby and you can't go back to sleep. Look at the clock. Within 90 minutes, you'll be primed to fall back asleep.
Awesome.
You know,
that's great advice. I mean, I think a lot of people don't understand the cycles that our bodies go through and the way that we sleep, and
it's our rhythm.
Our
all humans have it.
Exactly. And how babies have it, you know, in the same rhythm.
Yes, they do.
And
they just can't go for as many. An adult can stay awake for 5 or 6 of those 90-minute cycles. A baby, don't keep a young baby up for more than one cycle, more than 90 minutes. That's a mistake.
Yeah.
Little babies.
We're going to get into that to help your baby sleep longer, and that's we're going to talk about how to not get them too overtired.
Yes.
And that's a big part of it. You know, one of the things when we talk about how much sleep do you need, you actually can accumulate a sleep debt. Okay. A sleep debt is where, you know, we're talking about 7 to 9 hours, whatever your normal is, and then how many hours of debt of sleep you're going into, you know. If you're only sleeping 4 hours a night, then, and you're supposed to be sleeping 7 or 8, then you're going into 3 to 4 hours of debt every single night.
Yeah.
The good news is, well, there's good news and there's bad news, right?
Yeah.
So the bad news is that you can't, like...
No savings account.
Yeah, you can't build up a savings where it's like, okay, I'll sleep a lot.
I tried. It does not work.
I tried that too. I tried that too. Like, you know, sleep a lot over the weekend so you could stay up all week.
Yeah.
Okay.
All you're doing is paying off debt. You can never accumulate a savings.
But you can pay off debt.
You
so
can.
that is the good news. You know, so say that you didn't get a lot of sleep during the week. Your husband's working. You're up with the baby a lot. You're feeling really like, you know, totally deprived. And it's been days and days and days of that. The weekend comes, he's home, and you can get more rest. Even if you're up to nurse the baby, but he can do the burping, he can do the swaddling, and you go back to sleep. Or you're even able to, your baby's old enough and you can pump or get through a feeding, sleep through a feeding, let him feed the baby. You know, you can pay off some of that debt.
Yeah.
And catch up. And you can catch up on some sleep. And that's really, I think, one of the most important things to realize is that, you know, try to check in with yourself and see, what kind of debt am I accumulating so that you can make up for it?
Yep.
Whether that's a nap, or whether that's on the next day,
Yep.
or, you know, calling in a babysitter, or having...
Deciding not to do the laundry that day?
Well, that's a big one. That's a big one. And let's answer some questions. You want to do some viewer questions?
Yes,
viewer
absolutely.
questions. Okay. We've got a question here, and this question is from Maureen Modick from Ohio. And Maureen wanted to know, she said, I'm too nervous to ever co-sleep. We had a bassinet in our bedroom, and I would take the baby into the nursery to nurse at night, change his diaper, then nursed. So every 2 hours, it was totally waking me up, and I was exhausted. Any tips on nursing to make it quick and easy to feed and get back to sleep? So you had a bassinet in the bedroom. One of the things I would definitely recommend is if it's early on in the experience of, like, the baby's very young, you know, sometimes laying in bed is not the best thing because you're not getting the best positioning. And I'm talking like less than a month old. You know, people try to do it in bed. They're trying to, you know, sleep with the baby next to them, and that can be difficult. I'm not saying not everybody, some people can, but most people need to actually get up and nurse the baby the way you did. Good positioning is going to make your feeding actually go quicker, and so if the baby's latched and positioned perfectly, can actually make the whole experience go quicker. Keep the lights down, okay? So you don't want to turn all the lights on. Try to keep the lights dim so the baby stays nice and calm and quiet. You know, if you're nursing sitting up, you can actually do breast compression while you're nursing. So it's actually holding the breast, compressing a little bit. It kind of gets the milk to flow a little bit faster for you. And the one thing I can say is with a newborn, it's sometimes hard to make them nurse faster. But what I would recommend is make sure you don't feed them to sleep and not burp them. Okay, that's one of the biggest mistakes that people make, is that they're just like, oh,
they'll be up.
The baby fell asleep. Let me just put the baby down. And that's really a big mistake because that baby needs to burp. And if the baby doesn't burp in an hour, they're going to be awake again screaming with gas pain. Okay, so take the time to burp the baby and then go ahead and put the baby back down. As the baby gets older, you know, I nursed right in bed. I mean, I had a co-sleeper next to me. You have a bassinet next to you. lay down with the baby next to you and try to stay as asleep as you can while you're doing it. Put the baby next to you, nurse, and put the baby back. Those are my best tips, I think, for sleeping and nursing at night.
I had to get up for a little while to get the hang of it, and with the twins, I had to get up every time. But once my oldest daughter was older, I just would lay there and rotate sides, and that made it a lot easier on me.
And the other thing you could do at night is you can make your husband do some of the work. Okay?
Oh yeah, that my husband did. He always burped and swaddled and changed the diaper when I was done.
It doesn't all have to be you. So this whole process doesn't have to be only you. Yes, yes. Jen did tandem nurse. I was there.
Yes, she was. She taught me how.
Right from the beginning, actually. That was awesome. She was the best nurser I've ever seen in my life.
Thank you.
What can you do to try to minimize the amount of sleep deprivation that you're getting? Like, what are some things that you can do? And, basically, obviously, the most obvious answer is catch up on sleep. Now, that could seem obvious and it can seem impossible, like if the baby's not sleeping. But the truth is, the baby is sleeping. And so if you really were to ask yourself the question, am I really sleeping when the baby sleeps? You know, that cliche, like everybody says it, sleep when the baby sleeps, and then you're like, yeah, I got laundry to do.
Right.
Okay? The laundry is going to need to wait. All right. So you're going to have to
You need to put yourself on like a Facebook moratorium and, hold off on the laundry.
Except for our show, of course,
Exactly. That's 1 hour.
It's 1 hour. Very, very important. So the laundry might have to wait. The cleaning might have to wait a little bit. You might have to do some takeout.
Yeah. Use paper dishes.
Exactly.
It's okay for a few weeks.
And you just have to give up on being that perfectionist in the house, okay?
Yes.
Your well-being and your health are way more important than, how clean is the house right
Somebody
now.
just asked, does lack of sleep affect milk supply? And I'll let Shari answer that.
The honest answer is no. Lack of sleep does not affect milk supply, nor does stress. None of that actually affects your milk supply. If that was the case, then we would have some major issues throughout history.
Yeah, because I was very stressed. And I never had a supply issue, I have to say.
Women have been stressed throughout time, okay, through wars and famines and some horrible situations, and they still were able to breastfeed. Stress is not one of the factors that will decrease your milk supply. Now, if you change your behavior because of the stress, so because of stress, you stop nursing as frequently. If you're not nursing frequently, if you're going long stretches, if you're trying to substitute with a pacifier versus feeding your baby, that's going to affect your milk supply. But stress in itself and not sleeping, not really. We can't use that as a reason.
Yeah.
That's good. That's actually a good thing. You don't want your milk supply to decrease. But napping, sleeping in shifts on the weekends.
Yeah.
Like we were talking about before, catching up with sleep so that catching up on the debt. Okay, so that taking turns on the weekends when your husband's home to catch up on that extra sleep, getting grandma to come over, somebody to sit and hold the baby.
Yeah, after you feed them, pass them off.
Here's the thing, okay? Everyone wants to feed the baby. Yeah. Okay? Everyone wants to feed the baby. I get it. It's fun to feed a baby. They all want to feed the baby, but it's not their job. It's your job, okay? So what you can say is, I'll feed the baby, you clean the toilet. That'll go wrong.
Maybe change its diaper and rock it to sleep.
No, I'll do that. You clean the toilet. Okay.
Make me a lasagna, maybe. That might be better than the toilet.
Yeah, just having people really support you in ways of like cooking meals for you, doing some laundry for you, or just holding the baby while you nap is going to make a huge difference. So that extra help from other people.
Something great my husband and I did with the twins, because we both had to get up with the twins. He had to help me position them when they were really new. At like 7:30 at night, when we put our oldest daughter down, we went to sleep too. So even though we were getting woken up literally 6 times that night, we still got like 12 very interrupted hours of sleep. But we actually were like, we're not that bad. Like we were tired enough to fall back asleep, and it worked for that short-term time. I would do that.
That is great. That's a great tip. Like just being in bed, sleeping when you can, going to bed early. Yeah. Turn off the
got done, but
turn off the television. Okay. It's turn off the TV. Don't try to stay up late. It's not time to like start the new novel or anything like that.
The DVR was full by the time we were done with that.
You'll catch up on all your shows later. But it is important to really, you gotta kind of plan ahead. And how everybody's going, get your sleep now. Get your sleep now. Okay. Well, it's not going to make a difference anyway. But what they're trying to tell you is enjoy your sleep now.
Right. I would say rather than enjoying your sleep now or getting extra sleep now, start making things to go in your freezer for dinner. Yep. Like really, that's what I did with the twins. I literally had, no joke, 12 weeks of meals in the freezer because I knew it wasn't going to happen. And we had an 18-month-old that had to eat dinner. I couldn't just say, let's eat soup every night to her.
Right.
So I had to actually come up with something.
Yeah.
And that made a big difference.
Yeah, yeah. That's a really good, it's about planning for
Yep.
it. Planning ahead. And also talking to your partner, letting them know like what your needs are.
Yep.
You know, thinking about this now. Everybody always focuses so much on the birth. You know, just the birth. Let me get me through the birth. They're not focused on the breastfeeding. They're not focused on the lack of sleep. They're not focused on all these things that are going to be a big issue once you have the baby that people are kind of warning you about, but you're not really hearing.
Yeah.
So it's an important thing. Also, your nutrition. You know, nutrition is such a huge part. We talked before about how sleep deprivation can really decrease your immunity. And now we're going into the winter months. You know, flu season and colds and germs and with that decreased immunity, whether you're pregnant. Okay, and this goes for pregnancy or breastfeeding or postpartum, anytime, or just anytime. Your nutrition is very, very important. You know, making sure that you're eating lots of fresh fruits, vegetables, and really cutting back on those really heavy starchy foods because they'll also make you very sugars. White flours, processed foods. They're going to make you groggy. They're going to make you feel more sluggish. Yeah. Okay. Lighter kinds of foods, more fresh foods. Fresh foods are going to make you feel more alert.
Yeah. Yeah. Absolutely.
So that's an important thing, and building your immune system, doing things to help build your immune system. Yeah. One of the things that I like to talk about because I think that not enough people are describing or explaining is vitamin D deficiency.
Oh yeah.
And we talked about this vitamin D deficiency on an earlier episode with Dr. Dawn. Remember a couple weeks ago. It's already a couple months ago. But making sure that your vitamin D levels are adequate. Okay, especially during pregnancy, but also afterwards. So many of us, I think it's like over 80% of the population is D deficient.
Oh, yeah. I just had mine tested, and I've been taking the recommended amount, and I was still a little deficient, so I need more. Everyone's individual.
And that's a really good point because, there's, like, certain recommendations. Well, there's, like, there's the recommended daily allowance, which is, like, completely ridiculous. It's, like, 400 units, and that's nothing.
That's more than a kid.
That's less than a kid. Okay?
Oh, yeah,
so
less than a kid.
Less than a kid. I mean, and then you wonder, who's coming up with these numbers, so that we can, I don't know. I'm not going to get into it. Anyway, but we were talking about, like, doses at like 5,000 units, okay, is really more of a regular dosage for most people, or at least to get them to their norm. The way to know for yourself whether your vitamin D levels are normal is to actually have a blood test. So you really want to have that checked if you're seeing your obstetrician. They should actually be checking it. And go back a couple months to the episode that I did with Dr. Dawn on having a healthy pregnancy. If you are pregnant, go back and watch it all. I don't know what date it was, but it was Dr. Dawn having a healthy pregnancy. And we talked about vitamin D quite a bit in that episode and how important it is for having a healthy pregnancy, for preventing things like high blood pressure in pregnancy. So it's really, really, really important. And then building your immunity. You want to check your vitamin D and the levels that you want to be at. The blood test is called a 25 OHD. And your levels should be ideally around 60, but no less than 50. Okay, so somewhere over 50 is normal. 60 is more normal, but at least 50. A lot of us are way deficient. And if you're really deficient, like somewhere in the 20s or lower, you need way more than 5,000 units a day.
Yeah, I actually was extremely deficient. I'm very fair. You can't see that. I was extremely deficient. I had to go on a prescription D pill for a long time to get myself back up. And even going out in the sun without sunblock on still doesn't do enough for me. And my husband is dark, and he needs even more, and he can't just rely on the sun where we live here in New Jersey.
And there's a lot out there that will describe that, this is one of the best ways to prevent flu.
Right. Symptom of deficiency. Immune system going down. If you're getting sick a lot, that's a symptom of deficiency. There are tons of other, actually cancer can be caused by vitamin D deficiency. So there are so many symptoms of D deficiency. It's kind of systemic. The best thing to do, a lot of doctors do this test now. It's very common. Your OB will do it. Your GP will do it. And that will give you a really good guideline.
Yeah. And the last thing I saw that it was not included in the routine prenatal screening, but some doctors are adding it now.
Yeah, if you ask them, most should do it.
Exactly. And so what else? Co-sleeping we talked about. Skipping the housework we talked about, right? Focusing on yourself. Let's talk about the baby a little bit.
Yes.
Can we give vitamin D to the baby?
Yes.
Vitamin D to the baby, yes. So,
Absolutely.
okay, so people ask all the time, good question. People ask all the time, do breastfed babies need vitamins? The answer is no, except for vitamin D. Okay, that's probably the only vitamin that I do recommend supplementing your child with is vitamin D while you're breastfeeding, because most people, like we said, are deficient in D. If you're nursing, if you're nursing and you're deficient in D, you're not giving the baby enough vitamin D. And most of us don't have enough vitamin D because we're not getting enough sunlight. You need to have a certain amount of sun exposure at the right times of day without sunscreen. Now, how many of us are really out there? And especially in the winter months, you know, and the darker your skin is, the more sunlight you would need to get those vitamin D levels. And how many babies are out in the sun without sunscreen? Yeah. It's just not happening because your body will naturally make it with the sun. But it's just obviously not happening with us. So, yes, your baby will need vitamin D as well. The below 5 years of age, the recommended units are about 35 units per pound of body weight. Right. Okay, and then from 5 to 10 years old, it's about 2,500 units per day. Okay, but again, you should have your child's levels tested. For an infant, I don't think you need to do that.
No, you don't have to have their levels tested, but you just give them like one drop of the vitamin D drops. There's a bunch of different brands out there, and you can get them at the health food store. You give them one drop. I used to put one drop on each nipple and then give it to the babies, and that was just...
That's a great idea. There you go. Perfect. That's excellent. Okay, so let's talk a little bit about... what you can do. All right, so we all know that like not getting enough sleep is an issue for us.
Yes.
If the baby was sleeping better, then we'd be getting more sleep, right?
Exactly. So that's the root of the problem.
Let's get right to the root of the problem. Let's ask. We have a question here from one of our viewers. Let's answer one of the questions. The question here is, it was over here that I saw it. I'm sorry. The question was, this is from Lindsay in Georgia, and she said, is it normal for my 11-week-old to sleep most of the day and be up all night with maybe a short nap here and there? Is there anything I can do about it, or will she work herself into a different schedule? Okay. It's not normal, and
it is normal. I mean, it does happen a lot. It's not that this is...
It's common.
It's common, but it's not the way it's supposed to be.
Exactly. Exactly. And most likely, when I read a question like this, or I hear from someone like this, what I immediately am thinking is that baby may seem like they're sleeping, you know, eyes are closed, they're, you know, napping in and out, but they're really not getting good, deep sleep during the day. Quality sleep, like really good naps where they're, you know, getting their sleep quota for the day. Right. And what's happening is you're creating a child that is overtired. Yeah. Okay, that overtiredness actually has the child release hormones in their body, you know, that will cause them to be up more at night. Yeah. So this whole idea of like keep them up all day so they'll sleep at night, it does not work. It actually will create the opposite effect of what you're looking to do. Anyone with children will know if they don't get good naps, they're like maniacs, okay? They will not go to sleep. Why is that? You know, adults, when we don't get enough sleep or when we're tired, we crash. Right. Children just don't do that. Right. They don't do that, and neither do infants and babies. So it's really important. And if your baby is sleeping, it was Lindsay. Lindsay, if your baby is sleeping, you know, during the day, like in the living room, in a swing, in a bassinet where there's noise, where, you know, because we get this advice from grandparents a lot, you know, like let them get used to the noise, use the vacuum cleaner around them, don't let them sleep in a quiet room. I don't agree with that, okay, because what winds up happening is the baby's not really getting that restful sleep. And then the night comes. Right.
You do what you're doing. When your baby is asleep, they need to be sleeping, and when your baby is awake, they need to be awake. I don't want my baby thinking that living room is awake time, and I don't want her thinking that, or living room is asleep time, and I don't want her thinking her bedroom is, you know, awake time. Like, she needs to be sleeping when she's in her room. Yeah.
She's asking what if it's quiet? It needs to be quiet. It needs to be dark. Okay, so this whole idea of sleeping with the bright light in the living room during the day, we're talking about, like, you know, retreat time. Yeah. Retreat into another room, you know, actually swaddled. Sometimes babies...
Change of scene.
Let's talk about that for swaddling for a minute, because lots of babies cannot get into that deep sleep unless they're back into a womb-like environment. And we're talking about swaddling where the baby is feeling tight and confined, like back in the womb. Dark, Okay, white noise, all those things. Being in a place where the baby can actually rest. So,
and
quiet is not enough.
Also learn to associate those things with sleep. So if they're in the living room, where even if it's quiet, that's a place where they play, and you want them to associate their crib or their bed or their bassinet or your bed, wherever you want them to sleep, that should be associated with sleep.
Yeah. Maybe a monitor. Get a monitor, put the monitor on the baby, and put the baby into a nice dark room. You know, you want the baby to associate darkness with sleep and not lightness with sleep, because what are you doing at night? It's dark, right? Okay. And the swaddling will definitely help you. That brings up another question from another one. This is from Kristen in New Jersey, and Kristen is asking us, we love swaddling our daughter, and it got us through the rough times, and everybody knows I'm a big advocate of swaddling, but now she's just about 6 months old, and we still have to swaddle her to nap and to sleep at night. We want to break the habit, but don't know when or how. We're trying to leave one arm out, but she's so unhappy, and now she's exhausted and cranky because we've been at it for a few days, and she's only napping about 2 hours a nap, and so babies can be swaddled way longer than 6 months. You do not need to break this habit. I can promise you this. They're not going to go to kindergarten still swaddled. Right. You know? They can be swaddled for longer than that. I have babies that are swaddled up to 9, 10 months old. Okay. You just want to be careful with them, you know, that if they're rolling, that they are, you know, they're unobstructed, that there's not a lot of stuff in the bed where they can actually like roll back over.
Yeah, I would not leave a baby who is swaddled that can roll in a crib with anything in it whatsoever. Bumpers, nothing. And it has to be a good, firm crib mattress. That would be my concern if they were rolling and swaddled. It has to be nothing in that crib.
Exactly. Perfect. And definitely. Okay, what else, Jen? What else should we do when we're trying to get our babies to sleep a little bit better?
I breastfed all of my children, so whenever anybody says schedule, I get all, that's going to mess with your supply, and you can't schedule a breastfed baby. You can't, especially when they're really little, but when they get bigger, you can. And even when they're itty-bitty bitties, you can do a routine. There's no rules against routine. And when I say routine, I mean this happens first, this happens second, this happens third. Not at 7 a.m. we will do this.
It won't work anyway.
Yeah, exactly. It won't work. But, you know, you say, okay, we're going to have nap now. So we're going to nurse. We're going to change the diaper. We're going to sit in your room. We're going to listen to Twinkle, Twinkle, Little Star every day at nap time. I am going to bop you on the back and hold you until you fall asleep. And then I'm going to put you in your crib. Whatever you decide it is.
Yes.
And I'm going to say night-night and give you a kiss. And that's how it's going to be every day when we do this. And then at night, you're going to get a bath. You're going to get a rub down. As long as you do things in the same order, it will start to help you when you go to say, all right, now you're a big baby and we need to fit you into the schedule of the rest of the family. So you do have to start doing things at certain times because that's, you know, the world. And that will pave the way for that. Yes. And as Shari said, you know, the dark room, all of those things are going to help you, even if you think that they are. And I am a really strong advocate of no, like, television around young infants from, like, 3 p.m. until 9 p.m. And I know that can be painful for some families if they are used to watching the news, but the bright lights, the loud noise, whatever it is, if you have to have it on for something, put it on mute, because I think it makes them so wound up that they get cranky and roochy around, like, 7, 8, 9 p.m. They're just so overstimulated by it.
Well, babies are normally going to be so tired by the end of the day anyway. That's like that witching hour that, you know, you'll see your baby when you're trying to eat dinner, usually, and they're just, inconsolable, wanting to nurse constantly, wanting to, like, cry. They're just crying, you know, because they are really overtired from the whole day. And like Jen said, you start putting on the TV, you start overstimulating them
you're trying to cook dinner, the kitchen is bright. Like, we started actually eating our kitchen dinners by candlelight with low light because we found that our kids didn't really cry as much then. Because I think that it was just too bright with the fluorescent lights in the kitchen and the pots and everything else bipping around. I think that made a big difference. You know, that helped us a lot.
Yeah. Did you do that with Lily too?
No, and she was kind of grumpy at that time of night, and I figured it out later.
You figure out everything with your last baby or afterwards, and then you're like, I need another one just to do it right this time.
Exactly. That's exactly right.
Need to get it right. So yeah, I mean, this is definitely an issue.
Yeah.
I mean, our children did not sleep very well.
Right.
They were up. I nursed very frequently, and Talia, my little one, she was up. Even that second year, like from 1 to 2, she would wake up frequently.
Randomly,
I'd hear her from the other room, Mama, Mama. I mean, like I could still hear it going through my head.
Yeah.
She's 7 years old, and I
get
still
PTSD from it. You literally, I'll be in the car and I'll turn down the radio because I'm like, who's crying? And I'm by myself, but I hear someone crying. When does it stop? It's terrible.
I swear someone's crying.
I know, somewhere.
I still hear the Mama, Mama.
It's terrible.
Mama.
Yeah. Something else that I found helped us a lot with the twins, that we did not do with my oldest, I did not let her fall asleep all the time nursing. And I know that was so great to be like, oh, my little baby, she's asleep. But first of all, like Shari said, that's a bad thing with the burps. And second of all, it gets them into this weird habit of I always have to eat to go to sleep. Which it's nice for them to have a full belly before bed. Yeah. But during the day, I made it my goal with the twins to feed them and have playtime and then sleep time. Because if you always let them fall asleep at the breast, that's totally fine if that's your prerogative. But you are always going to have to do that because you are training them in a way that this is what you need to go to sleep. And you will later have to change that if you don't want to do it forever. If you want to keep doing it, that's no problem. But
children actually love routines.
Yep,
they
need
love
them.
Routines. And so whatever the routine is that you get them into is what they're going to do. Yep. And sometimes you're thinking that you're responding to them, that your routine is because of what they want. And what you're doing is you're perpetuating something that they're actually training you on and training themselves to continue. Right. So you've got to be very careful.
So you need to look at whatever you're going to do in the beginning and say, am I willing to do this when I don't feel good? Am I willing to do this when they're 6 months old, when they're 9 months old, when they're 12 months old and can, fight and scream with me about it? Am I willing to continue doing this? And if the answer is always yes, 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 then that's the perfect strategy for you. But if the answer is, well, maybe I don't want to do this forever, maybe I need to go back to work or something like that, then you want to look at, okay, we need to nurse the baby, play with the baby, then get the baby to take a nap.
Yeah, that's perfect. And it really does leave room for everybody to have their individual decision of what they're... I think what you're getting here and what you get from me most of the time is that there is no instruction manual on how to do this the right way. We're offering you tips and advice based on our own experience and from experts' opinions and moms' opinions and everybody in the chat room. But ultimately, you're going to find what works best for you and for your baby and for your family. And if it works, then that's the right thing to do.
I just want to help you figure out, this is what I want to do and how can I get to that point.
Absolutely. Absolutely. All right. So that is the end of our show tonight. Thank you guys so much. We had such a wonderful time. Thank you for being here with us, for engaging with us. I hope you learned a lot, and I hope you get some sleep tonight. It was another wonderful episode, and we will see you next week. Love you guys.
Yes. Go to bed.
Bye.